Good afternoon, everyone. Thanks for joining the Association of State and Territorial Health Officials, the Environmental Council of the States, for a series of webinars on risk communication of waterborne contaminants. I am Carrie Weiss, the Director of Environmental Health for ASTHO, and I will be starting us off. Today we'll be focusing on Per and Polyfluoroalkyl Substances, or PFAS, and on June 21st we'll be focusing on harmful algal plumes. These webinars have been made possible through funding from EPA's Office of Research and Development, and the contents represent the views of the presenters and do not necessarily reflect the views or policies of the EPA. Before we get started, we would like to ask a couple of polling questions. First, to get a sense of who is on the call today, please indicate which type of agency best represents your affiliation. Okay, and it looks like we have about a third from state health agencies, about a little over a third from state environmental agencies, some federal partners, and then some of our NGO or nonprofit partners. So thanks for joining. Next, please type what state your organization resides in. Okay, great. I'm seeing over half of the states represented, so thanks for joining. And lastly, what two areas of risk communication would you like to see additional guidance on for PFAS? This will help us as we formulate our next steps in resource development. Okay, I'm seeing the two top areas here are for the message, ensuring what you know and what you don't know. So thanks for participating in our polls. Again, we'll use this information as we formulate our next steps. So next I'll be turning to Sarah Grace Longsworth from ECOS to start us off.
Great, thank you, Carrie. We're so glad to see that there's so much interest in risk communication of these particular contaminants. PFAS and HABs are two priority contaminants that states struggle to communicate the risks of. Most state environmental and health agencies have oversight of their water systems and are responsible for implementing mitigation efforts to reduce chemical exposure, protect public health, and communicate the risks associated with contaminated water. Although the US EPA issued a drinking water health advisory of 7 parts per trillion for PFOA and PFAS, and draft recreational or swimming water guidelines values for cyanotoxins, states still issue their own health advisories and/or regulations related to these contaminants, compounding the efforts to streamline communications and help the public understand the risks involved. As state environmental and health regulators consider actions on contaminants, it's really important to frame the subject in a unified manner for the public and other stakeholders. So to help states overcome some of these communication challenges, ECOS and ASTHO signed a memorandum of agreement with EPA's Office of Research and Development to identify ways in which state environmental and health agencies frame their risk communications for the different contaminants. Beginning last fall, ECOS and ASTHO interviewed 13 geographically and programmatically diverse states on their risk communication strategies for PFAS and HABs. As you can see in this map, ECOS and ASTHO conducted interviews for the different agencies. ECOS conducted 7 case study interviews, 3 on PFAS, 4 on HABs, and ASTHO developed 6, 3 on each. And the case studies will be available publicly on our websites after we conduct a second webinar on HABs next week. One common theme we noticed across all the interviews was the need for clear, regular, honest communication that builds a level of trust between state officials and communities. We heard from several states that the public often trusts local officials more than they do larger state governments with whom they are not as familiar. So it's really important to partner with local government officials and get information out there early and often to the community leaders. To concerned citizens, the risks are very personal, so officials need to admit what they do and do not know, and also provide resources so that communities are aware of what to look for and what to do in the event of contamination. A second theme is the need to educate. For the public, it may be difficult to understand when states try to explain the changing values for acceptable levels of PFAS or multiple numbers for different PFAS chemicals. The public doesn't know the difference between reference doses, health advisories, and maximum contaminant levels, and differences in numbers among states confuse people even more. We learned that it is crucial for states to justify why they use a certain standard or guideline over another, including why it may be different from the EPA value. Information should be shared in language that is understood by most people. For example, an 8th grade reading level was provided as a good benchmark in some states. For states that have not had a major PFAS contamination issue or guidance value set, we hope these case studies will provide good models for their own risk communication strategies. It is similarly challenging to educate the media. While social media has been a great mechanism for getting information to as many people as quickly as possible, it can also be a curse, as it makes the flow of credible information difficult and sometimes causes unnecessary concern among the public. States have implemented health advisories for many years, but now the public can easily look up information online themselves. States asserted the need to maintain credible information control by encouraging responsible and accurate reporting of these issues. Another important theme we learned from states is the need for coordination. State agencies need to coordinate closely with one another to address risks of and responses to contamination. For PFAS, this includes environmental and health departments, departments of agriculture, and/or poison control centers. While it seems pretty obvious, states emphasize the need to establish roles and responsibilities for all players before an event actually occurs. The states we interviewed noted that multi-agency involvement is key, but collaboration only works if agencies sort out roles and craft messages prior to a contamination event. In addition, as we noted earlier, partnering with local groups in an area where there is little known contamination helps build credibility and trust among the public. Finally, timing is critical. Be consistent. The faster a state can disseminate information that is truthful and comprehensive, the better it will be received by concerned communities. Overall, it's really important to continue these collaborative efforts where states share what they know and use what they can from other states so as not to recreate the wheel. We hope these case studies will improve awareness of different risk communication strategies for PFAS and other contaminants of emerging concern, highlight resources already developed to aid with response efforts, and showcase partnerships forged to help address these contaminants in communities across the U.S. ECOS and ASTHO plan to soon embark on a second phase of the project to create a sample template for an actual advisory. This will include information on what communication models should look like, what doesn't work, and what guidance is needed for states compiling these materials. So today we will showcase 2 case studies on PFAS risk communication. We've asked 2 of the interviewed state agencies to describe their experiences, challenges they face, and how they develop and disseminate information to the public. So first, we've invited Brandon Kernan from the New Hampshire Department of Environmental Services, who will be followed by Jim Kelly from the Minnesota Department of Health. Please hold your questions until the end of both presentations. You can type them into the chat box for the facilitators to read, or you can ask them over the phone lines during the Q&A portion of the webinar at the end. With that, I'll hand the mic over to Brandon to tell us about how New Hampshire communicates risks of PFAS.
Thank you. I'm Brandon Kernan. I work for the state of New Hampshire in the Department of Environmental Services. I work in the drinking water program, but on this issue of PFAS and assessing its occurrence and working with the public, at our agency, we're really working across all division lines. So I work on a daily basis with our waste site programs and our air resource divisions, as well as with our public health agency in the state. Today I want to just give you an overview on our experience in finding PFAS and working with the public to communicate the risk. First of all, I just want to cover how New Hampshire regulates PFAS right now. At this time, we have adopted an enforceable waste site standard and also a drinking water standard of 70 parts per trillion combined for PFOA and PFOS, just 2 out of thousands of PFAS compounds. And our standard is in line with the revised health advisory EPA issued in May of 2016. We will note that while we've adopted this standard, other states have adopted much lower standards. Vermont, for example, just one state over, is 20 parts per trillion as a standard. New Jersey is looking at adopting even lower standards, and many states have guidance levels that are at 70 parts per trillion or lower, or that include more compounds than just PFOA and PFOS. And all that backdrop is really important because that complicates the public communications where there's different values coming from federal agencies and other states. Another thing that's really complicated the communication issue is the fact that standards or advisories for PFAS have changed pretty dramatically over the last 9-10 years. In 2009, EPA had issued a preliminary health advisory level for PFOA and PFOS. For PFOA, it was 400 parts per trillion, and for PFOS, it was 200 parts per trillion. And then you move just 7 years later, and the new health advisory is down to 70 parts per trillion combined. And all the while, in between 2009 and 2016, there were some site-specific action levels being used by certain regions of EPA, such as in Hooksett Falls of 100 parts per trillion. And so in New Hampshire, as we've worked with the public, and since we found PFAS in 2014 for the first time, we've had different messages relative to if your water is safe to drink or not. Initially being the 400 and 200 parts per trillion health advisory, then referencing the action level that was being used by region of EPA at 100 parts per trillion, and then a few months later changing it yet again to 70 parts per trillion when EPA issued its most recent health advisory. Just want to give you a sense of PFAS occurrence in New Hampshire and why we're really working hard to communicate this to our communities. We not only in New Hampshire adopted an enforceable waste site cleanup standard and a drinking water standard, we've also integrated that standard in a non-discriminatory way across all of our regulatory programs. So our waste sites, our groundwater discharge sites, water systems that we think are susceptible are sampling for PFAS compounds. And I'm convinced, based on what I know about PFAS, that the occurrence of PFAS that you see in New Hampshire in this slide, it will be any other state in the nation if you sample for it. If your state doesn't have a PFAS problem, it's because your state hasn't sampled broadly for it. And so you'll see on this map we have total PFAS detected statewide, less detected in the northern part of the state, which is lightly developed. And then as you move into the more developed parts of the state, you see more detections because there's much more land uses occurring in that area of the state. I just want to point out that, in my opinion, based on what I've learned about PFAS over the last few years, this is just not another new contaminant that we're going to talk about for a couple of years and move on to the next emerging contaminant. First of all, PFAS is different in that in New Hampshire we have 2 major contamination events due to air emissions. And this is where we had facilities that were coating fabric and drying the fabric and having blowers emit to the sky, and essentially they were blowing off submicron particulate particles, and those particles settled down onto the ground miles out from the plant and then dissolved with rainfall and contaminated groundwater for private and public drinking water supply wells. And this air source of contamination really undermines our approach to managing land uses to protect drinking water supplies, because no longer are you just looking at well protection areas and watersheds and contributing areas. The wind blows every which way from the source where it's being released. And so you really have a difficult challenge to delineate the extent of the contamination and quickly get potential receptors sampled and notified of their water potentially being impacted. In our state, these two sites have caused contamination over 64 square miles, and that could be a much larger area if we had a lower standard in the state. Another reason why this contaminant is different is that, unlike most contaminants, the health advisory and our standard in New Hampshire is at part per trillion levels. And while you lose some people right there saying, well, that's gone too far, regulating things at part per trillion levels, there's no doubt about it that part per trillion levels of PFAS in your water equals part per billions levels in your blood. It bioaccumulates, and the longer chain PFAS compounds that were historically used can reside in your body with a half-life of 3 to 7 years. And so part per trillion does show up at part per billion levels. And in New Hampshire and in other states, there's thousands of blood samples that show that correlates with drinking contaminated water. Another reason why it's just not new, it's just not going to be another new contaminant for a year or two, is that we've only addressed at this point 2 out of thousands of PFAS compounds, and surely there's other long-chain compounds with health advisories that will be coming in the near future from ATSDR and CDC. And other states, such as New Jersey, have already tackled some of the other PFAS compounds and are proposing standards. Another reason why this is different is that although the most recent EPA health advisory, and I'll get into this in a little bit, it's called a long-term health advisory, within the verbiage of health advisory, it makes real clear that you should avoid short-term exposure to infants or pregnant women. And so that's a pretty big health advisory where certain populations should not drink the water. Another thing that makes this contaminant different is that people that have been exposed to high levels of PFAS in their drinking water are demanding that their water have 0 levels of PFAS for the future. And while I think everyone understands there's no such thing as 0, because analytical methods can keep getting lower and lower and lower, the rationale of the public is that their bodies are contaminated. It's going to take years to get PFAS out of their bodies, and they don't want to hear that they now have 60 parts per trillion levels of PFAS in their body, and that meets our standard 70, when the quickest way to get it out of their body is to stop this exposure going forward. And so that's the rationale, and they are really firm in their belief that there should be non-detect levels of PFAS in their water, given that their bodies have been contaminated historically. And another thing, as I mentioned before, is that this is not going to go away, because other states are reviewing more and more health studies and showing that, based on their approach to standard making, that standards should actually be 1/3 to 1/5 of the health advisory that EPA currently has out there, and that New Hampshire has adopted as a standard. Just to give you a sense of the magnitude of the issue in our little state, and we only have 1.5 million people in our state, and so we're one of the smallest in the nation. Just in the last couple of years, over $40 million has been allocated to address PFAS at just a couple of sites in New Hampshire. And again, we're just beginning to get results from statewide sampling of all of our waste sites and other permitted sites. Again, we have a large area of contamination, 64 square miles in southern New Hampshire. That's something I never even could foresee ever happening in my career, but surely we have the data to show that that is what's happening in New Hampshire. We've lost 3 significant municipal water supply sources in our state, and we'd lose many more if our standard were to be revised based on future health data. And then since 2016, New Hampshire has sampled over 3,000 sources of drinking water. That's both private wells and public wells. And from that, we've identified over 600 homes, mainly near those air emission sites that had to be provided alternative water. And that's primarily through extending public water supply to those homes on private wells, and we've put in over 30 miles of pipe in just the last couple of years to deal with those impacts. Just to show the various areas in our agency that we're addressing PFAS, I have this pie chart showing where we're either collecting data and applying our standard or trying to develop policies relative to surface water quality standards, biosolids, and even doing source water protection, trying to work with fire departments on how to manage their firefighting foam. So across the agency, we're working in all areas, and our communications is not just with the general public, but also with the regulated community, many who had no idea that, that this was an issue until we integrate into our programs. If you're interested in getting information on PFAS in New Hampshire, you can do an internet search of New Hampshire Department of Environmental Services, and right on the top of our homepage will be a banner that brings you to our New Hampshire PFAS investigation page that has all of our fact sheets and web blogs and email notices, and it even has things like our most current sampling data. About 70% of the data collected in New Hampshire has been reported right into a database that within a day feeds this map viewer where you can view results of sampling in the state. And this has been a powerful communication tool because to the layperson, they have no sense of what it means to have contamination 1 town over, 2 towns over, what have you. But by providing this map, it enables them to go on, type in their address, and they can see if their home is near a bunch of yellow or red dots that have some levels of PFAS, or if they're surrounded by a bunch of green dots that have none, or very low levels of PFAS or non-detect levels. And so enabling people to find this on their own has not only helped them gain confidence in the state's response to PFAS, but has also alleviated a lot of requests and 15 to 30-minute phone calls, homeowner by homeowner, trying to talk them through what we know about PFAS in their neighborhood or in their community. So New Hampshire, in responding to PFAS above standards, we really prioritize an immediate response where we're aware that there are homes that are very likely above our standard. We have deployed sampling teams if the potentially responsible party cannot or will not get people out there rapidly. And DES will cost recover for our personnel's time as well as the analytical cost. We've facilitated some of this sampling by using either the state level or the local level reverse E911 calls, where within GIS you can specify an area that you're concerned about and click on the lots, and through the technology an automatic recorded phone call can go out to the homeowners letting them know that sampling teams are in the area, that somebody in a state vehicle might be coming to their home to collect a water sample. And it facilitates rapid notification of the public, and so when we show up, they're generally let you in and let you get your work done and get out and collect a lot of samples, and also notify the public ahead of time before you show up. We have done door-to-door sampling just by knocking on doors after these type of notifications occurred, including on weekends and evenings. And we've also done mass mailings, and again in GIS in New Hampshire we have a statewide tax map where we can identify properties with a dwelling that are not near a water line in an area that we think might be contaminated, and literally just by drawing a polygon around those lots that meet that criteria, we can make a mailing list and send out postcards or letters. Within an hour we can have hundreds of letters produced and ready to go in the mail. Another thing we do is when we get the results, we immediately contact homeowners. The lab is reporting results to a PFAS team in our agency, and we immediately ensure that before anyone leaves leaves work that day, that phone calls are made to homeowners to let them know if the results are over and to provide guidance on if they should continue to drink their water or not. We also have provisions to provide alternative drinking water immediately. We have, in communities where we know we're going to have a problem, we have stashes of bottled water either at fire departments or at town halls where the public can come and pick up water. We also have a state vendor contract with the bottled water company to provide deliveries, and yes, we have sampled the water that we have under contract for PFAS, and it was non-detect. And we've even resorted to sometimes using our own staff to make deliveries, especially to people that might not be able to transport water to their home due to transportation or physical limitations. Also, when we have detections above standards in drinking water, one of the first things we do is make direct contact with local and state elected officials. People go to them for with questions immediately when there's a problem in their community, and also those are the individuals that can often help provide us ideas on how to better respond and provide us additional contacts. So it's been very useful. When there's a potential of many homes being impacted, we'll issue a press release to let people know about what we found in case our other means of communication haven't been effective, and also to let them know we might be sampling in the area. And these press releases lead to numerous radio and television interviews for several days after the press release. Now, when we communicate the results of unregulated PFAS contaminants, it's complicated. In New Hampshire, we have elected to use analytical packages that have an extended list of analytes. That's generally from 24 to 27 analytes, and we seek the lowest reporting limits. Because you pay very little additional cost for more results at lower levels, and we don't want to constrain the science because we want to have that data as new information emerges in the future about health effects. But what that leaves us with is a bunch of results that we don't have a standard or guidance value to reference when we're communicating with homeowners. So we have to be in that uncomfortable position of explaining, here's what we know and don't know. And if you're concerned about the part that we don't know much about relative to health effects and the PFAS that we detected, here's how you can address it either through treatment or drinking alternative water. Generally, drinking water programs like to operate in a binary system where you can simply tell people water is safe to drink or unsafe to drink, but we simply can't do that here. And so the best fallback position is to do the best work you can and to communicate it as clearly as you can, and to let them know what you know and don't know and what they can do about it if they want to take steps beyond what we have regulatory authorities to do. With our contaminated sites, we do distribute information weekly or monthly through email updates, so people can sign up to be on an email list, and there's also posted on our website. Another thing we established for our bigger sites is a public hotline dedicated to PFAS, and that's been extremely useful because we've been able to train up a couple individuals to man the hotline, and it really frees up the technical staff that otherwise would have to answer all these questions. And each homeowner is very concerned and has a lot of questions, and these calls are generally more than 15 minutes each. And by providing somebody who can answer 80% of the questions and know who to seek out the answers from if they don't know the answers to the question, has been a very effective way of being responsive to the public and also freeing up technical staff that need to do their technical work. So I just want to talk a little bit about gaps and challenges that we have right now that hopefully will improve over time with PFAS. First of all, it's the fact that we don't have common standards or health advisories from state to state or for federal agency. And so right now, there's misaligned messages coming out from even certain regions of the country. And what that leaves you with is almost an inability to be effective whatsoever in communicating results to the public if your state has a higher standard or guidance value than the state nearby. There's no way to gain the public confidence, really, that when we have a standard of 70 parts per trillion and they know over in Vermont people are being provided water if you're over 20 parts per trillion. It's sort of like a race to the bottom situation where next time that another state proposes a lower value or a lower standard, it often has a bigger impact on New Hampshire than that other state, because we're sampling all over our state right now, and we have to explain to the public what the results mean, and the public is very aware of how the other states are proposing to regulate PFAS. Now, that's an important thing, and it's something we have to make clear to our public is that, many other states either have a lower standard or propose lower standards, but they're not sampling across the state and finding where the contamination occurs and providing people alternative water with those proposed guidance levels or standards, where in New Hampshire we have a standard, and as you can see from that map, we are applying it all over. And so while the science in another state might have driven them to a lower number, we're doing a lot more in New Hampshire relative to getting people off of contaminated water at this time. Another issue that's difficult is when people have contaminated drinking water, we deal with that, as I just explained, through messaging and our enforcing our standards and providing information about treatment or other options if people want to go beyond our standards. But we also try to let them know that PFAS exposure is occurring in their life in areas other than drinking water. And there's a challenge to communicate that because there's a lack of information about the significance of exposure to PFAS from other sources. And there's also a lack of information on what people can do to mitigate that exposure. Now, we do know from blood studies that CDC does routinely that we all have a base level of PFAS, no matter if our water is clean or dirty with PFAS. And so we know there's other exposures, but there hasn't been a lot of work on how to reduce that common exposure we're all having to PFAS from sources other than drinking water. I just want to highlight the current health advisory for PFOA and PFAS from EPA, and this is another area where there's a challenge. It's a lifetime health advisory, the advisory that was issued in May 2016, and that again is 70 parts per trillion combined for PFOA and PFOS. But in this red text here, which I'm not going to read, it makes a pretty clear statement that pregnant women and infants should seek alternative water. And so DES interprets this language to mean do not drink the water, because when there's water that's contaminated, you don't go out with a health message saying if you're a baby or if you're pregnant, don't drink the water, but otherwise do. It's a one-size-fits-all message. And so when we have detections above 70 parts per trillion, we tell people to not ingest the water. Other states have not interpreted this way, and therefore with future health advisories, we've asked EPA, and they're working with states to ensure that there's more clarity on how to communicate what that health advisory means. And just some strategies for effective community engagement. And first of all, in New Hampshire, we've found that providing up-to-date information and being as transparent as possible from the beginning is really important in gaining the public's trust and cooperation. We also have not constrained our science, as I mentioned before, to simplify public messaging. We could have limited our analysis to just PFOA and PFOS, and we could have had reporting limits of 20 parts per trillion, and our data would be a lot easier to deal with, as we have a lot of non-detects, and we wouldn't have all the unregulated PFAS compounds. But we know this issue is going to be here to stay, and we want to get as much data as possible, and we want to be able to get that out to the public. And we have to make clear to the public that what we're telling them right now, relative to our standards, it might change. I mean, right now we're all kind of waiting for that ATSDR report to see if there's new toxicity information for PFOS, PFOA, PFNA, and PFHXS. And that, just like the health advisory went from 400 to 70 parts per trillion, 70 parts per trillion could become lower. It might include additional constituents. And so we're bracing the public that this is an emerging issue and that there's more and more science, and our policies will change as there's science to back them up. Another thing that's important is that the public really wants to see all sampling results and project documents online in near real time. And in New Hampshire, our documents for our waste sites are put online, and so they can see sample results. They can see the letters going back and forth between our agency and potential responsible parties. Some of the things that we found effective is establishing community advisory boards where there's leaders in the community, both from the general public and local elected officials, to meet with leaders of the state and even federal agencies at the federal site to talk about issues on a routine basis in a formal setting. Other mechanisms that have been effective for community engagement include the hotline that I mentioned before, having community office hours where we have our leadership of DES go to local libraries for 2-3 hours, a couple of days a week, to be there to meet with people one-on-one and to answer their questions. Another thing we found effective is a web blog. In New Hampshire, we've elected not to maintain a social media presence because it just would be an overwhelming amount of time to keep up with. Continuing back and forth on social media. But we maintain a web blog where if we're aware of some misinformation or common questions that are reoccurring on social media, that we can address the misinformation or answer questions that are occurring on social media to sort of set the record straight, to the extent anyone wants to set the record straight. Another thing that's been very effective is providing water treatment guidance. So if people don't like our standards or are concerned about what future standards might be, they are enabled to take their water quality to another level on their own without having us having new standards or the science to justify them yet. Another thing that we found important, and I'm not sure how effective we've been at it because the exposed public to PFAS is focused on PFAS, but we try to really stress, especially for people on private wells, that they need to be concerned about other natural man-made contaminants that may have a higher relative health risk, and that if they're going to be testing their well for PFAS for a few $100s, it probably makes sense to spend $100 to get the bacteria, nitrate, arsenic, radon, radium, uranium result too, and so that if they are looking at improving their water quality, they're not just putting carbon in to address PFAS, but potentially addressing something that has a much higher health risk, such as arsenic in water. And so we continue to stress that, but sometimes the public has been exposed to a man-made contaminant that rings hollow, but we're going to keep pointing that out because it's important for public health protection. All right, thank you.
Great, thank you, Brandon. And as we said earlier, we're going to hold all questions to the end of both presentations. So I will now turn to Jim Kelly from the Minnesota Department of Health to discuss the work in Minnesota.
Thank you, and I want to thank Brandon for doing such a nice job setting the stage. He's covered a lot of the information that I think provides a good bit of background on these chemicals and the challenges they pose to us at the state level. So my name again, Jim Kelly with the Minnesota Department of Health, and I represent our Environmental Health Division, which manages just a variety of services across the state of Minnesota. We like to say no matter who you are or where you are in Minnesota, you're likely receiving services from either the state environmental health department or one of our local partners. So we're very active around the state in a variety of different environmental health topics. Just jumping right into the issue of the day here with regards to PFAS compounds, our really history starts many, many decades ago with the 3M company and a manufacturing plant they operate in our city of Cottage Grove, which is in Washington County on the very east side of our Twin Cities metro area. They manufactured these chemicals, a variety of them, beginning fairly shortly after World War II. There was disposal of waste materials from those processes, both on-site at the plant and then eventually at other waste disposal sites in further north in Washington County that were operated by private entities and received waste from 3M and from many other sources as well. The state's really been investigating this issue and working with our environmental agencies and health agencies since about 2002 when 3M first disclosed to us these operations. These chemicals were very new to us. We didn't know anything about it, and we had to work rapidly to get up to speed, at least as quickly as we could, to be able to understand what was going on and how we could work with the communities to help them understand. And most recently, guiding this work has been a consent agreement that was actually been in place for over 10 years between our environmental agency and 3M, and then most recently a lawsuit that was settled between 3M and our Attorney General's office that's really provided the resources to help us understand and respond to the situation in the East Metro. So that's been fortunate, both the history of cooperation with 3M and more recently with the settlement has allowed us to explore a lot of the issues in Washington County in a great amount of detail. So just briefly, the chief products that 3M manufactured at their plant in Cottage Grove were PFOA and PFBA. As we know that the electrofluorination process they used was neither very precise nor very efficient, so there were many other flavors of perfluorochemicals or PFAS compounds that came along with those products and with the waste products that were disposed of. So we primarily see PFOA and PFBA, but there are areas with the various waste sites that also contain PFOS-related wastes. We see PFHXS very commonly as well associated with the waste stream, as well as a number of other compounds that I have listed at the bottom there that seem to kind of go along for the ride. They're very often mixtures, and we see just different combinations of these mixtures as we examine the groundwater in other areas near these various waste sites. So as I mentioned, these three waste sites and the manufacturing facility of the releases of these perfluorochemical waste to the groundwater have created over 130 square miles of contaminated groundwater that's affected virtually all the major drinking water aquifers, impacted 8 municipal supply systems, over 1,800 private wells. We've issued over 600 drinking water well advisories to private well owners in these areas, and more recently been issuing advisories on some community water supply wells that have concentrations of PFASs above our health-based values that I'll touch on in a minute. PFBA is the most widespread of the chemicals we see, which isn't surprising given its solubility, its molecular size, and its ability to move easily through soil and contaminated groundwater. It's really a rather unique geologic setting in that the southern part of Washington County is bordered on three sides by the Mississippi River on the west and the south, and the St. Croix River on the east. And the geology across the middle of the county is complicated by faults, buried bedrock valleys, and other features that make groundwater flow, in some cases somewhat hard to predict, and have also caused challenges in terms of tracking the plume. There's also been some really interesting groundwater surface water interactions. We will see PFAS compounds discharging to surface water and then infiltrating into groundwater and creating expanded areas of contamination that we didn't initially anticipate. Obviously, human interventions this is a rapidly developing area. There are a number of community wells that have been added over the years, and that may have had influences on where we found detections of these chemicals in groundwater. Another feature that is maybe just barely visible in the upper left corner of the figure is those kind of dark gray blobs are where groundwater models would predict the extent of these chemicals would have been from their initial disposal sites. And as you can see, obviously they've contaminated a much wider area, again due to their unique physical and chemical properties that allow them to spread easily in groundwater and in the environment. So in Minnesota, we have a Groundwater Protection Act that directs the Department of Health to develop standards for chemicals in groundwater that define a quality of groundwater that's suitable for human consumption. So we've been doing this work under that 1989 law for decades, and for these chemicals, it's no exception. In 2017, we issued revised and updated health-based values for a number of PFAS compounds, including PFOS and PFOA. With also PFBA, which is again one of the more common PFAS compounds that we've detected in Washington County, and also PFBS. We evaluate these set of chemicals that we test for in an additive fashion and derive a hazard index. So that allows us to account for the differing level of toxicity of these chemicals, and also be able to make sure we're being protective in our actions and accounting for exposure to mixtures of these chemicals. Our values are derived to be protective for both long-term and lifetime exposure, but also that's intended to prevent excessive exposure during fetal development into the infant as well, because as we've come to understand, these chemicals are transferred to the developing fetus as well as transferred through breast milk and breastfeeding. So we've established our health-based values using a toxicokinetic model that allows us to predict those concentrations and derive our values such that we don't end up with exposures that exceed levels of concern. They're based on animal studies, as many of the other state and federal values are, showing slight liver and thyroid effects, and as well as immune system and developmental changes in infants and children. And currently, because of the lack of any clear guidance value for PFHXS, but given its very long half-life, we're using our PFOS value of 27 parts per trillion as a surrogate value, and using that in our additive calculations. So getting back to and touching a little bit on risk communication and community engagement, Brandon did a really great job in laying out what some of the challenges are with these chemicals in terms of risk communication and working with communities. And I'll try to touch on a little bit of what our experience has been here in Minnesota, and it's fresh in my mind. We just are coming off of a community meeting in one of the communities in South Washington County that took place just last night, where we were explaining to a small community why we had issued advice to them to curtail use of 2 of their 3 community water supply wells, which obviously is a source of consternation and worry for that community, because they're issuing watering restrictions and other things that will certainly cause the community to have to pay more attention to what their water supplies are doing. There's been a real evolution, I think, in the way that we conduct risk communication over the past probably 2 decades, and certainly since we've been engaged in this PFAS work over the last 15 or 16 years. I think you can differentiate those 2 kind of methodologies by referring to them either as communication, which is more of a one-way street, to engagement, which is really the way we prefer to approach things now. It's really a much more collaborative, a much more of a conversational tone. The way we operate our community meetings is that we typically, rather than getting a bunch of state officials up on a stage and talking at a crowd, we begin our meetings with at least a half an hour or more of an open house format where we have displays, and it's a time for a one-on-one conversations with citizens. And it's really a chance for them to get to know us and for us to get to know what their concerns are at the local level. Then we do some presentations and have time for open Q&A, and then we go back into that open house, and we'll stay as long as it takes till everybody's questions are answered. And I think that really helps establish that level of trust and that level of credibility with these communities, and allows them to be in a much better position to receive information and for us to really understand what the concerns are at a local level. So we've really found that this way of community engagement is to be much more effective than some of the more traditional methods of communication that may have been used in the past. So risk communication, I think, just simply put, is how do we make informed decisions about risk to public health? And it's really building the tools and building the information and the resources and bringing them to bear in the right places at the right time so that the public can be in the best position to receive and react to the messages that we're trying to deliver. And it really all starts with careful planning. I really can't stress that enough. We've really focused on developing sound communications plans for virtually every facet of our work, but especially around these PFAS site contamination issues. It really helps us know and understand who we're talking with and what messages need to be communicated, and really kind of brings together our knowledge about PFAS and what those community needs are so that we can make sure that when we go out to the communities, we're meeting those particular needs. And even in an area like South Washington County, where this has been a kind of a long-standing issue, each community is a little bit different, and each one comes with a little bit different level of knowledge. In some communities, we really have to start at the beginning and kind of do a PFAS 101 kind of briefing, and just so that they understand the history. And others that have, where we've had repeated meetings over a decade, we can really just focus on what we're there for to bring them up to date on, rather than starting back at the beginning again. So that communication planning helps us understand our audiences and really make sure that we're in the best position to meet their needs. Over time, we've developed some very general messages that we've used to communicate, and I think the bullets on this slide kind of highlight what those general messages are, and we've tried to hone those internally by developing talking points and internal message blocks, which really are the tools we use inside the health department and with our state agency partners to make sure that we're all talking with the same set of terms, we're talking from the same page and relaying the same information. And I think Brandon actually touched on a number of these. We're taking a cautious public health approach. As he mentioned, this is an area of active scientific research, and we have to talk about the scientific method, that science doesn't stand still. And we have, in fact, changed our guidance values for some of these chemicals 3 or 4 times over the years, and we can't promise that they won't change again in the future in response to new science. And that's tough, because people want to see science as kind of immutable and solid, and when we're coming to them trying to explain the uncertainties and that this is an active area of research, it can become very frustrating. But we promise them, as new knowledge becomes available, we'll let them know that we're never there just to give them information and walk away, that we'll share whatever we know, and oftentimes what we don't know. So acknowledging that uncertainty is really important, both on a human level and from a credibility and a professional level as well. We don't know everything, and we have to be able to share that and be willing to share that for us to be credible. Brandon touched on this, the differences in health guidelines between states and between Minnesota and the federal government. That's just a constant challenge, and it's getting harder and harder, frankly, both as we change values here in Minnesota, and then every press story that comes out that says another state has a different value, or EPA has different values, or now ATSDR that we're waiting for. Boy, that doesn't make it easier, but we just have to keep at it and keep explaining why we do things the way we do in Minnesota. A lot of times our meetings really come down to these core risk communication concepts that come from Cavello, who I'm sure a number of you are familiar with. And these are just the real basics for how we have to operate during these meetings. Empathy and caring is important more than anything at all. As they say, people want to know that you care before they care what you know. And I can't stress that enough. I mean, you have to be willing to be there at their level and listen to them on a human level before they're going to be interested in what you have to say. our competence and expertise is kind of our trade in coin. We really need to be able to communicate that, what we know and why we know it, and why we're certain about what we're doing. Honesty and openness, again, just as important at human level is just really critical. And then dedication and commitment. And while that can sound trite in some instances, they need to know that we're not coming out from St. Paul and then we're going to go back again, never to return. That we're going to be back out as often as we need to answer their questions. And we do also things like office hours and other activities that put us in contact with citizens on both formal and informal bases, so we can make sure that they can answer their questions. Developing risk communication tools is important, and we use many of the same tools that New Hampshire uses, obviously. Press releases. We have an email list of some 3,000 plus folks on our PFAS email list where we send updates, and that gets used regularly as well. We have a variety of information sheets that we've directed to various audiences, whether the community members, local communities, health professionals, and others who are engaged in this issue and who are our partners in this issue. And developing various pieces to help meet their differing needs, I think, is really important. So being flexible and being able to tailor those messages is really helpful. We've also created updated web pages where we try to have the most up-to-date information. And again, we work with our partners at the Pollution Control Agency. We've also developed an interactive map similar to what New Hampshire has that shows our groundwater data, where you can enter your home address, for instance, and see what the sampling results are in your neighborhood, and then fill out an online sampling request form. So that's been a way for people to really get good information quickly that is, on their block, for instance, so they can just see what's going on in their area. So being able to respond quickly to those information requests, while it takes some work to get set up, it's going to save us time in the long run. So keeping things current is really important as well. As well as answering specific community concerns. Throughout this process, we've had concerns and questions about, cancer. What are we seeing about cancer in residents? People talk with one another. They think there's a lot of cancers going on. In reality, cancer is many different diseases, and it's a very common disease, unfortunately. We've actually done 3 separate studies of cancer incidents in these affected areas that we've published and described for the community. One of the concerns we got early on was, I've been gardening with contaminated water. Is my soil contaminated? Is my produce contaminated? Is this a safe practice? So we did a homes and garden study where we measured perfluorochemical concentrations in soil and produce and house dust and so forth to help allay concerns about that. And then obviously we've got lakes and streams that are impacted, so we've issued fish consumption advice. And biomonitoring has been a project that we've done that luckily shows the value of all these interventions. We've done 3 rounds of biomonitoring that has shown that PFC levels of the accumulative compounds have declined substantially as a result of the interventions that have been taken here in Washington County and Minnesota to reduce exposures to PFCs through drinking water. And that's a very positive story to tell. So even if we can't answer individual questions about health concerns, we can show that we're protecting the population to the maximum degree we can by reducing these exposures through drinking water. So all that's good news. It really helps us kind of communicate the value of the work that we're doing on their behalf. So just in conclusion, I would echo that these chemicals pose a significant challenge to state and federal agencies because some of the human and ecological risks just still aren't settled, and that's going to be the case for a while. These multiple sources of exposure and differing mixtures is going to continue to be a challenge in trying to explain that. These chemicals are just challenging from a number of different perspectives, given their persistence, their unique chemical and physical properties, and the way they move through the environment. There's never been anything like this in my experience. And again, and such an active area of research means that, all this information could change in some period of time, and that's all these things add up to some really unique risk communication challenges. So it's something that bears a lot of effort, but it's also something that the public is really expecting of us, and I think that we're up to the challenge, and we're going to continue to do that. So I'm going to stop there as well, and we'll pause for questions.
Wow, well, thanks, Brandon and Jen. These have been really informative presentations, and you've shared with us some really great risk communication strategies. So we'd now like to open up the floor to questions for both presenters. You can type your questions into the chat box, or you can we can open up your phone lines through the phone. So while we're waiting for phone lines to be open, I will start with the chat box.
And ladies and gentlemen, if you would like to ask a question via the telephone, please press *1 at this time. Just a reminder, if you're joining us via speakerphone, make sure your mute function is turned off to allow the signal to reach our equipment. Once again, *1 for any questions, and a voice prompt on your phone will indicate when your line is open. If you'd please state your name before posing your question. And Carrie, back to you while we wait.
Great, thank you. The first question for New Hampshire, question about our landfills monitoring for PFAS.
Yes, they are all lined and unlined landfills that are active with monitoring networks have to be monitored for PFAS over the next year or two. And at this point, for our unlined landfills, we have 60% of them that have exceedances of our standard of 70 parts per trillion for PFOA and PFOS. Most of those are monitoring wells on site, and then I believe it's about a 90% detection of PFAS rate for unlined landfills. The good news about the landfills is that we're not seeing the plumes be anything like our larger air emission sites. We've only had a few private wells impacted by landfill plumes. There's no real fingerprint to PFAS at landfills. There's a different suite of PFAS compounds as you go from landfill to landfill, and even very rural landfills in communities that never had an industry and never took waste from industry have found elevated levels of PFAS. Another side of landfills that's complicated is that for our line landfills, they do generate leachate, and the leachate often goes to wastewater treatment plants. And so it's taking it from one place in the environment to another, be it either the surface water discharge or if that plant produces biosolids that are redistributed or sludge that goes back to landfill. So you have this cycle of PFAS, and we don't have a solution for that yet, but it's a problem that we need, just one of many other issues that we need to get at to holistically address this issue.
Great, one more text question and we'll turn to the phone. Can you talk about the funding sources for the well sampling that occurs? And I believe that this is for Minnesota.
Thanks. The majority of our work, again, has been funded through these consent decree with the 3M company. So the MPCA conducts the sampling, and then they're reimbursed by the 3M company. Some sampling related to one of the sites, which was more under state operation, has been funded by the Minnesota Pollution Control Agency funds. But I would say by and large the vast majority has been reimbursement from the 3M company, who's technically the responsible party.
Thank you, and we'll turn to the phone before we get back to the chat box.
And we do have a couple questions. And caller, please go ahead.
Hi, this is Mark Mataloni from EPA Region 2. Can you hear me? I just want to make sure.
Yes.
Yes.
Oh, okay, great. Thank you. So great presentations by both presenters. And I guess I would address this to both of you, but maybe Jim, even more so you, because you showed that one of those latest slides of all the biomonitoring data, and some of those PFAS and PFOA levels were not unlike the ones that were measured in this big, DuPont-funded CH study in West Virginia and Ohio. And so the question is, when people ask you about health effects of, especially, I've been drinking water above the health advisory, or I have biomonitoring data which shows that I'm significantly above, NHANES background. Do you make use of the CH study, the probable links report, the 6 disorders, and the follow-on medical report on how to clinically manage patients that have been exposed or actually have biomonitoring data?
Thanks, Mark. Certainly we've made use of the C8 studies in our educational materials and trying to explain to people, why we're concerned about these chemicals and what the potential health effects are. We don't get a lot into the individual health considerations and concerns, but we have provided information and have information available that they can take to their physicians to discuss, what these health concerns are. And if they have been exposed, especially through the biomonitoring program, and we have that documented, we have made a physician available that was associated with our biomonitoring program that would speak with them and answer more specific medical-related questions, and also speak with their physicians as well. So we've done that on both an individual basis through the biomonitoring study, and then tried to provide more general information for those who feel they may have been more exposed or have data showing that. So that they can take back to their physicians and try to seek whatever appropriate medical screenings or medical attention that they feel is appropriate.
Randy, would you have anything to add to that?
No, in New Hampshire we have a lot of biomonitoring data. It does show people in exposed communities with high levels of drinking water. They have 2 to 3 times higher levels of PFOA, PFOS, or PFHXS in their blood. We don't have a health message, and initially our state didn't really support blood monitoring because we didn't have there's no way to interpret the results, and you typically don't do a medical test for which you don't know how to respond. But the public was persistent and got the sampling, and at least we'll have the data for the future should there be some use for it.
Right. Well, we certainly in Region 2 have dealt with the same thing in Hoosick Falls, and that population, when the state finally relented and did do the biomonitoring, their average was 30x for PFOA above and Haines background. So yeah, and so that stimulated a lot of questions about what does this mean for my health, and that's why I'm asking. Anyway, great presentations. Thank you very much.
And just a reminder that it is star 1, and we'll take the next question. Please go ahead.
Hi, this is Andy Reich from Florida Department of Health, and I wanted to ask about the funding because I know a lot of the states, including Florida, have limited budgets to go out and sample and do analyses. So I know we heard from Minnesota. What about New Hampshire? How do you guys fund the sampling of the private wells for these contaminants?
Well, initially when we became aware of the air emission sites and the high levels of PFAS and then neighboring private wells and small community water supply wells, management just chose for us to go out and do sampling, and it was just diverting resources initially from other projects that had to be pushed back that maybe didn't have as immediate of a health impact concern. As time has moved on, though, we've been able to cost recover on most of our sites. There's viable, responsible parties that have willingly stepped up and really taken over paying the invoices as they come in. And then, in New Hampshire, and I think this is for any state where you have data to provide to decision makers, having high quality drinking water is really a nonpartisan issue. And so our legislature even supports providing some funds through a drinking water, groundwater trust fund that we have for more statewide sampling. But in general, we always try to cost recover, but otherwise we'll use our hazardous release cleanup fund, which might divert from other projects, and then the legislature followed up by supporting us with some money from our trust fund.
Do you use state laboratories, or do you go out to private entities?
We have contracts with 3 commercial labs right now and have used about 5 commercial labs over time. Our state lab does not provide the service. The lab costs, I will say, have gone down quite a bit, especially if your state puts out a contract for bid with a lot of sampling over a number of years. You can see price reductions of 50% compared to the list value of an analysis. So if you're a state that's planning to do sampling, it's worth putting out a very competitive bidding process, all the while making sure our highly qualified labs bid, because right now it's most of the labs, especially for the extended list of compounds and the low reporting limits, are using in-house analytical methods, and that's all going to be cleaned up over the next year or two as EPA is issuing new analytical methods. But at this time, you have to really make sure you vet the labs and see if they have NELAP accreditation or DoD accreditation, and then also look at their blind performance evaluation sampling test, and maybe even do your own test on labs to make sure you're getting good quality product.
Thank you very much. Very interesting.
And once again, if you do have a question, please press star 1. And Carrie, I'll check with you to see if there's any additional web questions.
Sure, we do have a lot of questions, and it sounds like we may need to utilize some follow-up after the call for some of them, but let me go ahead and ask one that's related to risk communication. It says, please comment about the challenges of multiple agency partnerships. It's not always easy to reach agreement on how to communicate risk when different stakeholders have differing missions and or priorities. Either of you comment on how you've dealt with this issue?
Well, this is Jim.
Oh, go ahead, Jim.
Thanks. Yeah, this is Jim Kelly in Minnesota. It's really been a collaboration from the beginning between our Department of Health and our environmental agency, the Pollution Control Agency. I mean, virtually from the get-go, from day one, we've worked together on this issue, recognizing we have different responsibilities and different sets of skills that we are bringing to bear on this. But it's a lot of communication. We had interagency teams that met on a regular basis. We have very regular communications at virtually every level of our agencies, from the executive offices down to the staff level. About a week or so, we're having a day-long kind of get-to-know-each other training opportunity where we're going to bring newer staff up to speed on our history of dealing with PFAS compounds here in Minnesota. So we really work very regularly together, but it takes effort, it takes work, and you have to be sure that you're inclusive.
And the same from New Hampshire. From the beginning, it's been collaborative, and we've been able to come to an agreement very quickly on appropriate health messaging. I think the biggest challenge is that PFAS has required so much attention, and there's so many sites that emerged that we really need to increase our capacity and have additional toxicologists and risk assessors. Our environmental health program does an amazing job, but the same people that are helping us with PFAS are working on, Lyme disease and mosquito-borne diseases and other completely unrelated public health outbreak issues that are really big deals right now in New Hampshire. And so they are just spread really thin. They've been able to support us, but we've worked with the legislature to identify a need to increase more capacity for environmental health issues so that we're not spreading those people too thin and taking them away from those other important health initiatives.
Great, thank you. And I'm going to take one last question, and we are leaving our contact information on the screen for follow-up, and we will provide the presenters' emails as well. So the last question is, what advice or experience would you share with the states regarding risk communication where PFAS has not yet become a major issue?
Go ahead, Brandon.
I think if a state is in a position where they haven't, it's not an issue because they haven't collected occurrence information, then that's pretty straightforward. I mean, you can give anyone $10,000 in access and you would find PFAS if they knew what they're looking for in a given state. So if there's a state that hasn't started looking for it, I would encourage their health officials to look at the toxicity information generated by EPA and CDC and other states, and based on how they've regulated other contaminants environment, see if they think it's in line with what they want to regulate in their own state, and if they find that it's consistent with how they protect the public from other contaminants they should do PFAS, they should start developing a plan and funding mechanism to address it in their state because they have it. It may be that some states have different criteria for making standards and they won't pursue it, but I think each state, the health officials should at least look at this issue and assess if they should address it, and if so, start planning and funding. And you can't protect the public if you don't test for it and mitigate the impacts.
Right. I would agree, and to that I would add, our experience here in Minnesota with PFAS compounds really caused us to pause and scratch our heads and and say, how do we avoid this again, again in the future? And we from that, we with funding from the legislature, we created an emerging contaminants program where we try to look ahead to see what are the next contaminants that are coming down the road that we want to be prepared for. So it gives us a little bit of leeway to get in front of the curve a little bit, so we're not caught flat-footed the way we were with these PFAS compounds. And we're also developing, toolkits and other information for public water supply operators, especially to help them understand and talk about these unregulated contaminants, because it is so much more different and challenging than dealing with your traditional, water contaminants that are regulated under the Safe Drinking Water Act. So we're doing everything we can to try to stay ahead of the curve, but it's a challenge.
Great, thank you again. And we do have a lot of questions in the chat box, but please email them to the project team listed here, and we will be sending around the slides and links to the recording of this webinar afterwards to everyone that is registered. So I'd like to thank everyone again for joining today. Please tune in next Thursday at the same time for a similar risk communication webinar on harmful algal blooms, and the registration link is on the screen here. Again, we'll be sending around links to the case studies for all 13 of the states that we looked at for both HABs and PFAS after the end of our risk communication webinar series next week. And we will send around the slides from the presentations today to all registered participants. I'd like to thank you again and have a great afternoon.
And ladies and gentlemen, once again, that does conclude today's conference. And again, I'd like to thank everyone for joining us today.